like if you sit in this chair for 10 years and you never get up,
Sure.
all of a sudden you try to stand up and go for a run, your legs aren't going to work.
Yeah.
It's the same way. It's going to take time,
Yeah.
but the sooner you do that, the better off you're going to be.
Absolutely.
Welcome to the Ask an Audiologist podcast. Real audiology white papers and real audiology topics explained to you by real audiologists and a guy who isn't. Now here are your hosts, Dr. Jordan Strong, Dr. Michael Squires, and Kevin Ziener.
Well, it's Monday, and that means it's a brand new episode of Ask an Audiologist, and because it's Audiology Awareness Month, we decided to bring back both Dr. Michael and Dr. Jordan. As always, I'm your host, Kevin Ziener.
I'm Dr. Jordan Strong.
I'm Dr. Michael Squires.
And I guess we can just get into all the things that people should be aware of every day in their life as it relates to hearing loss and their safety, but primarily in October, we need to be really diligent about audiology awareness. So there are a billion different avenues that we could explore. We only have 9 minutes and 15 seconds and counting to be able to do so. So I will defer to both of you who have chosen this profession to talk to the audience about what you think are some of the most important elements that patients should be aware of when it comes to this month and just living life in general. So Dr. Jordan, please.
Oh,
Put you on the spot, and what is the most important
thing? That is
thing?
a loaded question,
Yeah.
Ziener.
Right.
I think one of the most important ones is, and one that I think is most prevalent right now, is cognition.
Okay.
That is very much, I feel like, the top of mind for most people.
Mm-hmm.
I'm seeing more and more commercials talking about it, whether that be from hearing loss and tinnitus, whatever it may be. But I do think that cognition is one of the most prevalent currently.
And the links of hearing loss to that.
Correct.
Because with more and more research and more studies that are coming out, we're seeing this huge prevalence of untreated hearing loss being strongly linked to dementia or Alzheimer's or just general lack of cognition. Dr.
Yeah,
Squires.
I think that is probably what I would say.
Got it.
Is untreated hearing loss has been found. Well, first of all, in our research in audiology in the past 10 years, what we're finding is that the brain uses the ears a lot more than we ever really realized that it did.
Sure.
Up until this point, we were just treating a hearing loss. Now what we realize is we're not just treating a hearing loss, we're treating a more global issue. Sensory neural hearing loss is like the third most prevalent chronic health issue. Is it in the United States at least, maybe in the world. And with that comes links to other things. So what we're finding is untreated hearing loss, like you had just mentioned, is very strongly linked to development of dementia and Alzheimer's and cognitive issues. But also fall risk, and kind of that's where my little happy place lives, is that if we can prevent somebody from falling, look, the statistics are crazy. It is, if you get on and Google what the fall risk statistics are, it's like, it's out of this world. And Medicare is responsible for billions and billions of dollars in healthcare expenses related to falls, right? I think Medicare is responsible for something like $50 billion annually, and it's supposed to
people
increase.
Simply falling and the aftermath of all of that?
Yes.
Wow.
Yep, and the follow-up, which is insane. But if we could just err on the side of prevention, what could we prevent, obviously, in terms of quality of life, right? We're not talking about broken wrists or broken ribs or broken hips or, the quality of life decline that we see after a fall in many cases. But also think about, we all have loved ones or know of somebody who has taken a fall, and then we see what happens in terms of cognition after that. So everything declines, right? If it's a severe fall. And the link between hearing or untreated hearing loss and falls is as great, if not greater, than that of dementia and Alzheimer's.
Yeah, exactly.
And I would imagine, because, and I think we've addressed this on the podcast before, patients on average wait 7 years to even walk into a clinic.
It's more than that.
It's like, somewhere between, depending on the study, but somewhere it's between 7 and 10 years.
Got
And
it.
I think there was a study that even said about 12, something like that.
And that is obviously every year, every day, every hour that goes by, it makes it harder to treat or harder to hold on to the hearing that you have, which thus makes it more difficult to maybe potentially keep your balance, to rejuvenate that cognition. And so even if we're able to kind of cut that timeline down by half, I imagine it makes a world of difference in that patient.
Yeah, I mean, one example that I kind of frequently tell some of my patients, it's like if you sit in this chair for 10 years and you never get up, all of a sudden you try to stand up and go for a run, your legs aren't going to work. It's the same way. It's going to take time, but the sooner you do that, the better off you're going to be.
Absolutely.
Yeah.
Well, it's rehabilitative.
Right.
It's not, you know, take one of these and call me in the morning.
Right.
It's a rehabilitative process.
Yeah.
We have to treat the hearing loss. Look, the fact that it takes 7 to 10 years, that means that's 7 to 10 years after we've identified a hearing loss. That hearing loss was there before that 7 to 10 years. So what if the hearing loss was there 5 to 10 years prior to that, and then we're waiting 10 years. Now we're at 20 years.
Now we've taken a third of your life where you are not hearing the way you should be.
Well, that's exactly right. And it's not what the patient thinks they should be hearing, it's what the brain wants to hear.
Right.
And everybody's brain reacts to that a little bit differently, which is why it's rehabilitative, which is why things like oral rehabilitation are so important. Insurance doesn't pay for this type of thing with an audiologist. And that's where I would look at you insurance companies and say, you know, and patients and consumers out there, call your insurance companies and put it to them. This is really important because it's rehabilitative. Maybe they don't pay for the hearing aids. That's a tough one to argue because we'll sit here all year and argue that until next Audiology Awareness Month. But by gosh, those rehabilitative services, those preventative services should be reimbursed for sure. And it's right now it is reimbursable through like through speech therapists, but not by an audiologist who's trained to do it.
Right.
So one of the things that I think awareness is meant to do is obviously spread the word, right? And it is very easy for an individual to, you know, unprofessionally diagnose somebody with hearing loss, right? Because, you know, grandma can't hear me when her back's turned to me, or, you know, dad has the TV cranked all the way up. So what's a skill set that somebody can possess, or some verbiage that somebody can possess to say to a loved one or a friend to hopefully get them into a clinic, and besides saying, well, it's October, which means it's Audiology Awareness Month, Mom, you got to go.
And we're all very aware of the hearing loss.
What are some key phrases or words, or just pulling on the heartstrings that people can say to somebody?
Yeah, I think one that frequently resonates with some of those patients who may be like more denial, things like that, is it's not always that you can't hear, it's that you can't understand. You know, that's where your loved one is turning the TV up. It's not that they couldn't hear the TV lower, it's that they couldn't understand what was being said.
Right.
So I think that resonates with a lot of people it's not volume, it's clarity.
Right.
Yeah.
And I think too some of that is generational.
Sure.
Yeah.
You know, we've talked about this on this podcast before. You know, I think that some of the younger generations or my younger patients are a lot more motivated to treat it now. Let's get this done. But then we have some patients that are in those older generations that's just they prioritize things a little bit differently. And so what I find is that they're not all that interested in adding more. Like if you can gain stuff, that's fine. It's easy to say like, hey, look, I'm doing fine the way I am right now. I don't need to spend this money, you know, to gain things because I'm doing fine the way it is right now. But in reality, it's not what they stand to gain, it's what they stand to lose. That is the motivational factor. And what they stand to lose is cognition, independence, which to that same generational cross-section is really important, you know? And so they stand to lose communication with their loved ones because what happens with grandchildren to their grandparents who can't communicate with them is they stop communicating with them.
Sure.
Right.
And we don't want that for them because ultimately it impacts their quality of life.
Right.
What's one final tidbit that you both would have as it relates to kind of just audiology in general, or you know, properly maintaining your hear care ability? Like, what is something that you would say to a patient on their way out the door after having seen them to maintain the hearing that they have? Avoid speakers. Don't go to a NASCAR.
Don't go anywhere. Sit at home. No. I think, you know, part of quality of life is being able to do the things that you want to do when you want to do them. And we find that people retract from their normal everyday, you know, activities. They don't go to dinner. They don't go to these events because they can't communicate in those areas. And so the things that I typically will tell patients is, look, you go to the dentist, you go to your primary care physician, you go to your optometrist, go get your hearing checked.
I want to see you too, right? That's what you're saying. I want to see you
What about
guys.
me?
Yeah, come on.
What
for
about
sure.
us?
Yeah.
I mean, it doesn't have to be professional. You
Yeah.
can just come in and say, hi, I'll drop that
Yeah.
otoscope in here real quick,
for
make
sure.
sure there's nothing
Bring
in
me
there.
donuts?
Yeah, that's right.
No,
We have coffee.
Bring me donuts, yeah, come on.
In reality, it's one of our senses. It's one of the 5 senses that people neglect at
Yeah.
a huge, overwhelming rate.
Yeah.
Because they pass it off as no big deal, or they pass it off as everybody else's problem. And it's not everybody else's problem. It's your responsibility to take care of a healthcare issue that you are having, and it'll improve your quality of life and the quality of life of everybody who's communicating with you.
Yeah.
So follow up.
Yeah, I think that we're getting into a time period where preventative care is something that's more
Totally.
prevalent. So I do think maybe we'll see more people that are coming in for just a baseline hearing test.
Yeah.
You know, if nothing else, it's just get a baseline.
Yeah.
Let's see where you're at. Yeah.
Love it. Well, there is no better week of no better month than for you to go to askanaudiologist.com to better educate yourself on audiology as well as hearing loss and potential hearing loss that you may be suffering from. Great job today, guys.
Thanks.
Thanks.
We'll be sure to properly honor October Audiology Awareness Month by putting on headphones for 30 days and
Yeah.
making sure that nothing bad happens to us whatsoever.
The after effects would be horrible.
Yeah, don't do it. Maybe not.
We'll see you guys next week.
Take care.
You can find more information at askanaudiologist.com, and you can follow us on all our social channels at Ask an Audiologist. The information provided on this podcast is for educational and entertainment purposes only and does not substitute for professional medical advice.